Falls are the leading cause of nonfatal unintentional injuries in children and the leading cause of emergency department visits in infants. But how to prevent them often isn't discussed with new parents.
Come in.
Hi guys, how's everything going in here?
Oh, it's going good. Just so tired.
Yeah, that's understandable. How's he doing? Is he nursing for you?
Yeah, he's nursing. We're almost finished here. He's been on for like 15 minutes, so.
Okay, alrighty. Well, how about you just ring for me once he's done and I can help you take him back to the bassinet.
Okay, that'd be good.
Okay, alrighty.
An infant is a child under 1 year of age. And for the purposes of this discussion, a newborn is an infant who is just born and is still in the newborn nursery. Pennsylvania birth hospitals report an average of more than 60 in-hospital newborn fall events per year. Although most newborn falls do not cause permanent harm, almost a quarter require more testing to ensure that the infant does not have an injury. Across the United States, the Joint Commission estimates that between 600 and 1,600 newborn falls occur in the United States annually within the newborn's first days of life. What about when the infant is brought home? According to the CDC, falls result in about 2.8 million emergency department visits per year and account for half of non-fatal injuries in infants. Despite these alarming statistics, the true number of incidents is much higher, since many falls happen at home and are never reported, and yet many parents are unaware of the dangers. The good news is that infant falls are preventable if you understand the risks and take the precautions to protect against them. All infants are at risk for falls, and the number one risk is a tired parent. But what new parent isn't exhausted all the time? Everyone is at risk of falling asleep while holding an infant, but there are some things that may increase that risk. Being sleepy, exhausted, or under the influence of alcohol or drugs, including some prescription medications, impairs your ability to take care of your baby, making bed sharing even more dangerous. The American Academy of Pediatrics does not support sleeping in bed with your infant. Also, you need to look out for environmental risk factors, such as placing the baby on a high surface, in a device, putting them in a device without buckling them in securely, or placing them where they could be smothered by pillows or blankets. Tiredness can cause poor judgment about safe handling and positioning of infants, leading to accidents that can happen in seconds. Always keep in mind that even an infant who can't yet roll can still fall off a surface.
Evan, wake up. The baby's on the floor. I don't know. I fell asleep, I think, feeding him. Let me call the nurse.
Hi guys, what's going on?
I don't know. He was on the floor. I
think he fell asleep while I was feeding him.
Okay, all right. Let me just take a closer look at him, okay? Just to make sure that he's okay. I'm just gonna take Skylar really quickly. Thank you. Just do want to take a closer look. Sometimes, things can look okay on the outside, but on the inside it could be something, that we want to keep an eye on. Did you see a little bump right here in the back of his head? So anytime things like this happens, I do like to notify the pediatrician. I just want the pediatrician to come and take a closer look at Skylar. All right. Do you mind if I take him to the nursery?
No, please.
Okay. Hopefully this won't take us too long, but I will bring him back.
Okay.
It's okay. It's just an accident. He's going to be okay.
Most falls do not result in injuries. However, some of them do cause minor injuries, like bumps and bruises, and can also cause major injuries, like bleeding in the brain or a fracture of the skull or clavicle. If your newborn falls in the hospital room, immediately call for help. If your infant falls at home and shows obvious signs of head trauma, call 911 right away. If there are no signs of an injury and your infant is acting normally, contact their doctor. Falls are common and can be serious, but they're also preventable. Infant falls can happen when someone drops them, for example, when a young sibling is holding the baby. Falls can also occur when infants roll or scoot off of beds, changing tables, or other furniture. Another cause is a parent who drifts off to sleep while holding the baby, often during feeding. You can't predict when you will fall asleep. However, being aware of how tired you are and taking some precautions can help prevent your infant from falling. Remember the ABCDs of sleep. Baby should sleep A, alone, B, on their back, C, in a crib, and you should be aware of D, dangers. Being sleepy, exhausted, or under the influence of alcohol or drugs, including some prescription medications, increases your chance of falling asleep while holding your baby. Even though parenting is a 24-hour-a-day role, it's important for you to get as much rest as you can. Try to sleep when the baby sleeps. Even short periods of rest while your baby is sleeping alone in their bassinet or crib can help keep you alert. Don't hesitate to ask visitors to leave so you can nap. When you're in the hospital, ask your nurse to place a note on your door when you are sleeping. And if you feel too tired to care for your baby safely, make sure you place them on their back in a bassinet or crib and never in your bed. If you're in the hospital, call for your nurse if you need help. And when you're at home, try to have a support person nearby whenever possible to make sure you don't fall asleep while holding the baby. Here are some safe strategies for overnight feeds. Anytime you fall asleep while holding or feeding your baby, the baby is at higher risk for sudden infant death syndrome, suffocation, or sleep-related causes of death or injury. Before feeding, assess how tired you are. If there's a chance you might fall asleep, stay in bed, remove the blankets, and set a 15-minute alarm. If possible, have a more awake person observe you. Couches and armchairs can be very dangerous for babies when shared with an adult who then falls asleep. If you do fall asleep while feeding your baby, once you're awake, put the baby in a safe sleep environment right away.
All right, guys, I'm back with Skylar.
How's he doing?
Fortunately, the pediatrician said everything looks pretty good, okay? So we are just going to closely monitor that little bump on the back of his head, okay?
Okay.
And things I want you guys to be mindful of. If he's getting, excessively sleepy, Malia, if you notice that he's not nursing well, things like that, I want you to notify me right away.
Okay.
Okay? Do you have questions about anything?
I don't think so.
Okay. All right.
Most infant falls do not result in significant injury. However, even when the baby is fine, it's natural for parents and caregivers to feel guilty or upset about the event. If your infant has an accidental fall, try to use the experience to think about what you will do differently in the future and make plans to prevent another fall from happening. Being aware of the risks involved and taking the proper precautions should help both you and your baby stay safe when you are awake or asleep. If you have any questions about what's safe or how to prevent falls, talk to your primary care provider.